Right now in the United States, we have a terrible stage orange healthcare and medicine system where healthcare and medicine is done mostly for profit. The way healthcare and medicine is taught in universities is also in a very mechanical, materialistic fashion, such that a lot of holistic healing modalities are ignored. The spiritual and psychological aspects of health are completely ignored. Your insurance company, for example, won't even pay for life coaching or for certain kinds of therapies, for psychotherapy, for other kinds of what we might call new age healing modalities, which are very, very effective, like perhaps like acupuncture or chiropractor services, or even more weird services like various kinds of psychic healings that you can get and stuff like that. Like none of that is covered by the mainstream healthcare and medicine system because it's not recognized as being legitimate or valid, because stage orange is very materialistic. And so our healthcare system is just like our education system, where it's basically like factory farming, where you just kind of put a sick human being through the system. You send him to a doctor. The doctor goes through the checklist of what he was taught to go through, and then he prescribes pills and medications because that's all he's been told to prescribe. That's what he's been indoctrinated with in his medical training, is that, hey, if a person has this problem, then you just prescribe this pill. And of course, the pharmaceutical industry is making sure that that system stays that way, because they bribe the education system and they bribe all the doctors with good paychecks and good bonuses and incentives just to keep prescribing the medication. And then, of course, what kind of medicine and healthcare is advertised all over the TV? It's materialistic medicine, which doesn't address any of the root issues. It just is like a Band-Aid on a wound. So very few healthcare professionals in the US, whether they're surgeons, doctors, people who are trying to help you to lose weight, or even mental healthcare professionals like psychotherapists, almost none of them have a deep understanding of what human illness stems from the incorrect psychology. None of them have a spiritual dimension to healthcare and to medicine, which is one of the most important dimensions. They just try to quickly treat a surface symptom rather than helping you to address the root cause. And oftentimes this only makes the problem worse, not better. So what might a stage green or a stage yellow healthcare system look like? Very different. First of all, it wouldn't be done so much for profit. There would be a lot better ethics in the healthcare and medicine system. Also, it would open itself up to new modalities, the new age modalities that are not as hard-nosed scientific as we insist on right now. It would open up to modalities from shamanism and from other parts of the world. We would look, for example, at how do they do healthcare in Japan? How do they do healthcare in South America? How do the shamans do healthcare in little tribal villages? How do they stay thin in tribal cultures? They don't have an obesity problem in many cases. How do they do that? So we would look at all this stuff. How do we use herbs and other kind of natural supplements? Not just pills, but a lot of supplements are more effective than pills. But of course, this is not recognized by many doctors and by the big pharma industry. We might also start to think very differently about psychedelics. How can we use psychedelics as medicine? And right now, there's some really good research that's happening in the last 10 years where they will probably soon be legalizing things like mushrooms and MDMA and LSD for clinical therapeutic uses, because they're so effective at treating depression, they're effective at treating PTSD, they're effective at helping people cope with end-of-life problems and so many other things. So this is all starting to it's starting to come on board, but we're like really in the early phases. And so if you're a doctor and you're passionate about healing people And hell, if you have been passionate about being a doctor, that's why, ultimately, you didn't become a doctor to enter some kind of bureaucratic hospital system or the health insurance industry. You became a doctor because you wanted to heal people. So that's what you got to focus on as a doctor. And then your question should be, well, if I want to heal people, what are all the most effective ways at healing people? Let me go and explore and research all the different modalities that are available all around the world, throughout all of human history, find the best ones, experiment with them myself, and really be able to help heal people. Not just heal them physically, but also help heal them psychologically, help heal them spiritually, recognizing that there's a deep connection between our physical ailments, our psychological illnesses, and our spiritual disconnection from the truth. And so by taking this more holistic approach, incorporating all of these elements together, that's how you can really become an amazing healer. But then, of course, you got to ask yourself, but there's this giant bureaucracy of the insurance industry and the hospital system and all of this, the education system for medicine. How do we transform those systems such that they acknowledge all of these multiple dimensions of health?